Um, Thank you so much for the invitation. I'm so pleased to share this interview and in this interview, and I will be glad to answer all the questions that you be asking. I will start with the first question. You asked me what is global health. Because it's mostly area in news and more many people are talking about what's global health and then why it's important people should pay attention to it. Firstly, global health is defined as an area of study or research or practices that make it a priority on improving health and achieving equity in health for all people worldwide. Some people mistaken it from public health, but public health is on the national level, while global health is globally as stated as global health. So, global health focuses on international health issues and determinants and solutions of health. It involves many disciplinary within and beyond the health issues. These might include the government, the hospitals, and many other different stakeholders. And also to deal with global health. It's not only about health sciences, but to deal with global health, and also is a synthesis of population-based prevention with individual level clinical health care. Although global health places greater priority to prevention, but it's also it also embraces curative rehabilitation and other aspects of clinical medicine and the study of basic sciences. Uh, People should pay attention on global health because of the following reasons. It's really important for people to know it because it has been there and it has declined the decline in death of both communicable and non-communicable diseases, and also there is a great improvement in maternal and child health, and in relating to control of infectious diseases, and it promotes safer workplaces and control the environment, as well as reducing the risk factors that cause the healthcare problems. So people should understand what's the meaning of global health and then be able to support it as they are among the important people, because all things work in global health, or people who are involved in global health work for people. And for the second question asking about communicable and non-communicable diseases, many people don't really differentiate the two, but communicable diseases are diseases which are contagious. This means that they can be spread from one person to another, or from it might be an animal. So uh, again, for while non-communicable diseases are those diseases which are not spread from person to person, hence they are not contagious. Rather, they are caused by changes in lifestyle, eating habits, environment changes, and malnutrition or long-term illness. Some of side effects of medicines or may be heredity, like cancer, diabetes, heart diseases. Some of the examples of communicable diseases are not indicated. It is it can be like tuberculosis or AIDS and malaria, and mostly they are transmission from blood or feces or other body fluids. In this contact might be directly. Transmission, where indirect contact transmission includes air, water, food, and insects. So, going to the question you talked about of Ebola, Ebola is a virus disease and is an uncommon but a killing disease that mostly affected people and affect people and non-human primates like monkeys, gorillas, and so Ebola is caused by an infection with five virus Ebola species. These four can be caused. The four can cause the disease to people, while one that I will mention called Western virus is only causes to cause the disease to non-human primates. There is Ebola virus from which is called Zaire Ebola virus. There is Sudan Ebola virus. There is Thai Forest Ebola virus, which come from Cote d'Ivoire. It's called Cote d'Ivoire Ebola virus. And then Resto virus is which is known to cause disease is in non-human primates, as I've mentioned, and in also in pigs. So some people wonder if Ebola is a communicable or non-communicable disease. Ebola is a communicable disease because it can be spread from one person to another. It is spread to people through direct contact with bodily fluid to the person who has been infected, or the dead person who had Ebola virus, or touching objects that have been contaminated by the people, or virus getting through the broken skin or mucous membrane or the eye and mouth of the person, or through direct contact with the blood, body fluids, um, and tissue of an infected fruit, or birds or primates. Through sexual contacts, also people can get Ebola. Mm, so to prevent Ebola, there are some intervention that should I would require for a person to prevent himself from getting to Ebola. These because nowadays Ebola there is no vaccines that can cure Ebola. But if you travel in an area affected by an Ebola outbreak, make sure you can do the following. Uh, Practice careful hygiene and do not handle items that are in contact with infected people. You have to avoid funeral or burial rituals that require handling the body of someone who died of Ebola. Avoid contacts with the birds and non-human primates, fruits, and eating raw meat from those animals that I've stated above. Also, avoid facilities in West Africa because there was an outbreak, and still patients are treated in those facilities. And also, you have to avoid if you're a woman and you have a husband or any person you know that a man that you know that has got Ebola, you have to avoid contact with the semen from a man who's an Ebola anti-Ebola is gone from him. Uh, this question about raise a person's risk of getting Ebola, what would raise? Uh, there are many things that would raise a person's risk of getting Ebola. Firstly, living in an area where the Ebola is an outbreak, and also if you're a family or if you're having an patients of Ebola, and this can take you to the risk of getting Ebola. And also, if your doctors and all healthcare providers and you're not well covered or dressing appropriately during treating Ebola, you can get affected. Mm. Yeah, number five, yes, me, how to prevent or lessen the chances of getting Ebola. People should do, as I've said, those those preventions that I mentioned, uh, that of practicing careful hygiene, handling, do not handle items which are in contact with infected people, and also avoiding living in area where there is a Ebola outbreak. And so this say that there can be a general rumors and misinformation and even panic when the community or the society if thinks that there's an outbreak. So people should really be educated about the myth and facts, because there is strong need for educating people about facts versus myth. Facts depend on reality or truth, whereas myth is an approved or false corrective belief used to justify a social position. So people need to understand the facts about the outbreak to be able to know how to deal with it. Risk factors and be able to prevent it. If people have facts, it will reduce panic around immigrants and children of migrants, around travelers, and around healthcare workers, as it was. People with Ebola will not be abandoned in the society, but instead different stakeholders starting to for the best interventions. We state the best interventions on how patients should be treated and cared for in order to avoid its spread all over the world. And also, this a scenario of Cassie Hickton's as a nurse who went to the States and was abandoned or isolated because he was coming from the country where there's an Ebola outbreak to break. And this really difficult of balancing individual rights and government responsibility. However, though it is really difficult, due, due to the fact that individuals have the right to travel, but again, it's necessary for the government to perform its responsibility of protecting its people against outbreaks. Regarding Cassie's situation, I believe that as she is an American citizen too, should understand that the measures that the government have put in place to protect its people, and also they putting her in isolation for monitoring the symptoms and the return in normal life is not a bad thing. She should have respected them, and then after checking on her, then come to the normal life. That's how the government works, because they protect one people and but also with other people not getting affected. Mm, uh, Coming back to the smoking and tobacco use, it's really considered as a World Health Program and raises similar issues to Ebola in terms of rights and responsibilities. So anyone should know that smoking harms health. For instance, I would say what it does to the body. Smoking harms the body in a manner that it causes diseases and disability and harms nearly every organ of the body. Smoke causes cancer, heart diseases, stroke, lung diseases, and diabetes. It also causes obstructive pulmonary disease, which includes emphysema and chronic bronchitis. It also leads to tuberculosis, certain eye diseases, and problems of immune systems. So it's really cause harms to the body. And not only are the people who are affected are the people that involved in smoke, but also the second-hand smoker. So when a person smokes, the and breathes out, that smoke affect the people who are near her. There are numbers given that indicate that 41,000 deaths among non-smoking adults and 400 deaths infant in share. This is really a big number. So second-hand smokers suffers too, because they suffer from smoke, lung cancer, and coronary heart disease in others. Also, infants exposed to second-hand smoker are at increased risk for sudden infant syndrome, acute respiratory infections, middle ear diseases, and more respiratory systems and slow lung growth to the infants. So typically talking about the uh, if tobacco is an addiction, it's really a strong addiction. It brings a strong addiction because so we should think tobacco as any other substance abuse. This is because actually uh, my answer would be yes, it's really a substance abuse because the reason being that the tobacco is addictive. As other drugs, most smokers use tobacco because they are addicted to nicotine, and this sign of addiction is characterized by the habitual drug seeking and use, even in the face of negative health consequences. People know that it can cause lung cancer, people know that it can cause different stroke, and many different things, but they continue smoking. As other drugs have health consequences to the body, even tobacco brings those negative health effects, such as sleep disorder, depression, cognitive and attention deficits. So people should try all the